Most men experience morning erections without understanding what they mean, and many men notice morning erections disappearing without understanding that this disappearance is simultaneously reporting the state of their vascular health, testosterone, nervous system, and sleep quality. Today I am explaining all of it. I am Dr. James Whitaker, board-certified urologist, and today I want to explain something that I cover in detail during almost every annual health discussion I have with male patients over 50, because most men have morning erections without understanding what they mean, and increasingly, many men notice morning erections disappearing without understanding what that disappearance is telling them. The morning erection is the most information-rich daily health indicator available to the male body, and learning to interpret it correctly is one of the most valuable things a man can do for his health monitoring. The technical term for morning erections in clinical medicine is Nocturnal Penile Tumescence, NPT. The terminology tells you something important. Morning erections are not a single morning event, but the last of a series of erections that occur throughout the night during sleep. In healthy men, nocturnal penile tumescence occurs 4 to 6 times per night during each period of REM sleep, rapid eye movement sleep, which occurs approximately every 90 minutes throughout the night and increases in duration toward morning. The morning erection that men notice upon waking coincides with awakening from the final and typically longest REM period of the night. The mechanism of nocturnal erection is identical to the mechanism of waking erection. It is simply driven by a different trigger. During REM sleep, the autonomic nervous system shifts to parasympathetic dominance. The parasympathetic nervous system stimulates the endothelial cells of the penile arteries to produce nitric oxide, causing smooth muscle relaxation. This process is entirely automatic, driven by the neurological events of REM sleep rather than by sexual thoughts or arousal, which is why men experience nocturnal erections regardless of the content of their dreams, and even during completely non-sexual dream content. The biological purpose of nocturnal erections is tissue maintenance. The erectile tissue of the penis, the smooth muscle cells and collagen of the corpora cavernosa, requires regular oxygenation to maintain its structural integrity and functional capacity. At rest, without erection, penile tissue has very low blood flow and operates in a relatively hypoxic state. During an erection, highly oxygenated arterial blood perfuses the erectile chambers under pressure, providing oxygen that prevents the fibrotic tissue changes, specifically the replacement of functional smooth muscle with collagen that accelerate when erectile tissue is chronically under-oxygenated. 4 to 6 nocturnal erections nightly represents the maintenance schedule that evolution has built into the male body to keep erectile tissue healthy and functional across decades of life. The presence of morning erections tells you that 4 critical health systems are all functioning adequately, and the absence of morning erections tells you that one or more of these systems has changed. Let me walk through each system and explain what it contributes to morning erection production. System 1. Vascular integrity. Morning erections require the penile arteries to dilate adequately in response to nitric oxide. This demands functional endothelium. The single-cell lining of the arteries must be healthy enough to produce nitric oxide when stimulated. Loss of morning erections frequently precedes symptomatic coronary artery disease by 3 to 5 years. In clinical cardiology, this is now recognized explicitly. Erectile dysfunction, and specifically the loss of morning erections, is a reliable early marker for subclinical cardiovascular disease. System 2. Testosterone. Adequate testosterone is required for the neurological circuits that mediate nocturnal penile tumescence to function with normal sensitivity. Testosterone acts on androgen receptors throughout the central and peripheral nervous system, including in the spinal erection centers and the pelvic nerves, maintaining their responsiveness to the parasympathetic drive of REM sleep. When testosterone declines significantly, as it does progressively with age, and more rapidly in men with obesity, sleep disorders, or chronic illness, these neural circuits become less responsive, and the erection that REM-associated parasympathetic activation should produce is diminished or absent. Please subscribe to this channel right now. I am Dr. James Whitaker, board-certified urologist, and I post this level of detailed physiological education every single week. Hit subscribe, hit like, and comment below right now. This week, how many mornings have you noticed a morning erection? Give me your honest number, 0 through 7. This is a health question, not an embarrassing one. I read every comment personally. System 3. Neurological integrity. The entire morning erection cascade, from the REM sleep signal in the brain through the spinal cord, out through the pelvic nerves, to nitric oxide release at the penile arteries, requires intact neural pathways at every level. Diabetic autonomic neuropathy can damage the pelvic parasympathetic nerves, before peripheral sensory neuropathy is clinically apparent. Prostate surgery can disrupt the neurovascular bundles adjacent to the prostate. Spinal stenosis, lumbar disc disease, and multiple sclerosis can interrupt descending pathways. The pattern of how morning erections are affected compared to erections produced by direct manual stimulation helps urologists localize the neurological level of any impairment. System 4. Sleep architecture, specifically REM sleep. Since nocturnal erections occur specifically during REM sleep, any condition that suppresses, fragments, or eliminates REM sleep will reduce or eliminate morning erections, regardless of vascular, hormonal, or neurological health. The most common and most consistently underdiagnosed cause of absent morning erections in men over 50 that I encounter is obstructive sleep apnea. Sleep apnea fragments REM sleep by producing repeated arousals, sometimes hundreds per night, before REM periods can run their full course. Men with severe untreated sleep apnea may experience essentially no REM sleep, and consequently, essentially no morning erections. A single drink in the evening significantly reduces REM sleep quantity during the first half of the night. Men who drink regularly in the evenings often notice reduced or absent morning erections. This is a direct neurochemical consequence of alcohol's effect on sleep architecture, not a sign of any structural problem. So what does it mean when morning erections are present, but weak or less frequent than they used to be? This pattern, declining rather than absent morning erections, typically indicates early changes in one or more of the four systems before they reach the threshold for complete absence. It is an early warning signal that deserves attention rather than normalization. A man who notices morning erections declining from 6 or 7 mornings per week to 2 or 3 mornings per week over a year should schedule a physician evaluation that includes morning testosterone, fasting blood glucose, HbA1c, blood pressure assessment, and a sleep quality discussion. Not wait until morning erections disappear entirely. What about morning erections that appear but are shorter in duration than they used to be? Normal morning erections persist for approximately 5 to 15 minutes and may include multiple tumescent episodes as the man moves in and out of REM during the final sleep period. Shorter duration erections that resolve immediately upon waking can still indicate adequate erectile mechanism function. The quality of the erection, its firmness and duration, is more informative than its presence alone. The practical daily practice I recommend to all male patients over 50. Notice and mentally record morning erection frequency on a weekly basis. If you notice a consistent change over 2 to 3 months, either in frequency or quality, schedule an evaluation. Use this information as a free, daily, non-invasive health indicator that summarizes your vascular, hormonal, neurological, and sleep system status every morning. I am Dr. James Whitaker. Morning erections are your body's daily report card on 4 major health systems. Start paying attention. Subscribe for weekly medical content. I will see you in the next video.